Yes,
Okay, ma'am.
please.
Yeah, ma'am. A very good afternoon to all of you. Thank you for joining. On behalf of NIMA Central and NIMA Central of Gynae, I welcome you all to our NIMA Obs Gynae webinar series. Myself, Dr. Meenakshi Singh, and I will be coordinating this webinar with Dr. Sujata Shyam-Kumar. I'm glad to share with you all the objectives of our NIMA Obs Gynae Central. This is an excellent initiative taken by NIMA Obs Central to bring forward such webinars with excellent topics from reputed and excellent speakers. NIMA, that is National Integrated Medicine Association of Obstetrics and Gynecology, India, aims to impact education and supporting and protecting the character, status, and interest of the integrated medical professionals. Its objective is to spread knowledge and to fasten education in integrated obstetrics and gynecology, to encourage and to promote services for the betterment of health community, maternal and child health care, to organize and participate in the field camps. I would like to give a few instructions to all the delegates before joining and moving towards this session. Please keep yourself muted during this session. If your mic is found unmuted, disturbing, interfering, speaker, you will be either be kept in the waiting room or removed from the session to maintain the decorum of the program and to avoid any kind of disrespect to the speaker. And lastly, at the end of the session, you can put your questions in the chat box or raise your hand in the chat box too. Moving towards our session, before starting, with due permission of all the delegates, let's have a virtual inauguration ceremony with Dhanvantri Mantra. Om Namo Bhagavate Mahasudarshanaय Vasudevaय Dhanvantaraय Amrit Kalash Hastaye Sarva Bhay Vinashaye Sarva Rog Nivaraya Trilok Pathyay Triloknathay Shri Mahavishnu Sarup Shri Dhanvantri Sarup Shri 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 Aushad Chakra Narayana Nama. As we all know that the topic of this webinar series is thin endometrium and integrated approach and management. A healthy endometrium is essential for a healthy pregnancy. An endometrium thickness of less than 14 mm is typically considered normal at any stage of the menstrual cycle. During menstruation, the endometrial thickness of a menopausal woman ranges between from 2 to 4 mm who are not on hormone therapy. And for those who are on hormone therapy, the ET can reach up to 15 mm. A thin endometrium occurs when the endometrial thickness is less than 7 mm. These can affect 1 to 2.5% of the total pregnant women. Reasons of thin endometrium include uterine abnormalities, structural issue of the uterus structures, any history of the past surgery, long time use of the birth control pills, and poor nutrition. Coming to the webinar series, we are privileged to have Dr. Pratiksha Rathore, ma'am. We are honored to have you, ma'am. We also welcome all the delegates present today. Dr. Kamini Dhiman, ma'am, President NIMA Obs Central, Dr. Vinayak Temburnikar, sir, President NIMA Central, Dr. U.S. Pandey, sir, Secretary NIMA Central, Dr. Priyanka Nakhade, ma'am, Secretary NIMA Obs Central, Dr. Vishnu Bhavane, Treasurer NIMA Obs Gynae Central, and Dr. Ashutosh Kulkarni, sir, Treasurer NIMA Central. We also welcome all the delegates who have joined the webinar. We welcome you to the wonderful session. Before we start, let's take a moment to introduce our guest speaker, Dr. Pratiksha Rathore, ma'am. I would like to invite Dr. Sujata Shyam-Kumar, ma'am, to give a brief introduction of ma'am. Over to you, Sujata, ma'am. Thank you.
Thank you, Dr. Meenakshi. Good afternoon, one and all. Myself, Dr. Sujata Shyam-Kumar.
And it is my pleasure and honor to introduce Dr. Pratiksha Rathore ma'am to all of you. So I want to tell you about Dr. Pratiksha ma'am. Madam has done her graduation BMS from Government Ayurved College, Nagpur, and MS in PTSR from Tilak Ayurved Mahavidyalaya, Pune. Presently, she is working as an associated professor of the department and PhD co-guide in the department of PTSR, MGACH, Datta Meghe Institute of Medical Sciences, Wardha. She has experience of more than 8 years, and Madam pursued 1-year fellowship in Panchakarma. She is pursuing PhD in Ayurvedic antenatal care, 1-year fellowship in Ayurvedic oncology, PG course in psychotherapy and counseling. She conducted clinical projects in the area of gynecology and published various research papers in national and international journals and published 2 books on the subject of gynecology. She delivered various talks on the subject of gynae and obs. Madam has received Best School of Chikitsak Award 2022 and Yuvat Award by Himalaya. She is a director of Gyno Ayurveda, which is a platform for teaching and learning in clinical Ayurveda gynecology. So, with due respect, I would like to invite Dr. Pratiksha Rathore madam to start her session. Over to you, ma'am.
Very good afternoon, Pratiksha ma'am. It's our honor to have you on this dais now today. A very dynamic personality and a good academician.
Thank you so much. Thank you so much, ma'am. Dear all respected office bearers of NIMA 𝙀𝙃𝙄𝙉, I'm so thankful to you for having me here. I hope I try my best, because this is very actually a unique topic, I feel, and it's very much needed. And thank you all for providing me such a great platform. And
Diyan, tara headphones kya hai?
So I hope I'm visible and audible too.
Yes, yes.
Yeah. Okay. Okay. So first of all, there are some disclaimers. Like first, whatever I'm going to talk is my view, my personal experiences, my opinions, and whatever I have learned my students. And so there may be some different opinions out there. People do not agree with me on various topics, because after all, we are in the medicine, right? There is always maybe, may not be. So this will happen. So whatever I have learned and I'm dealing with, I'll try to share with you. And also one request, whatever questions you're having or you will have, I hope maximum of them will be cleared off during the session only. But if any, we can discuss it after the session, so that I can cover all the things, all the PPT. Yes, we don't want to sit up to 7 p.m. I hope everybody have their job, clinics, patients. I understand. Thank you so much, everybody, for your time. So I'll share my PPT. Is it visible?
Yeah. Yes, ma'am.
Yes, ma'am, it is visible. Yeah.
Also, whatever people are, the audiences are typing in chat box, I am going to read it in last only. So type in last only. Okay.
No problem.
Yeah. So directly we'll come to the topic. Okay. First of all, let me clear my objectives. We have audiences. Maybe it is going live. We have audiences from like freshly pass outs to the senior most people. Okay. So I try to express the things in simpler as well as complex ways. I don't know how it is going to be, but because see, this is the different. We are not IVF people, right? Right. Like we are not first in few patients or few audiences maybe like that. What is that? What is PRP? what is endometrial, how thin it should be, and all these questions. And some people are maybe they are assisting IVF and they're doing this thing and they're doing this thing and all. So there is varying audience over here. There is some noise.
Little disturbance in audio. Huh?
So we are talking on the thin endometrium. Thin endometrium is, there are two types of endometrium, right? The normal endometrium. So first of all, there is difference between thin endometrium like abnormalities and endometrial receptivity. Okay, endometrial is a totally different condition which we consider in the luteal phase, during the luteal phase, right? And the endometrial thinness, the topic which we are talking about today, which we look at it in the peri-ovulation period, that is around the ovulation. Okay, so how much thin is a problem? So less than 7 to 8 mm around the ovulation. If we assess the endometrium, if it is less than 7 to 8 mm, some articles, it's not like it is 100%. If less than 7 mm, it is 100% failed, and if it is more than 8 mm, it is 100% successful. It's not like that. It is all about the statistics. So if it is less than 7 to 8 mm, there are less chances of conception. Okay, so less than 7 to 8 mm around the ovulation period, we call it as a thin endometrium. And if it is less than 6 mm, it is 100%, there is 100% poor prognosis. This means in thin endometrium too, there are some chances of conception, but not sure whether the pregnancy is going to continue or not. Okay, and how much thinness is not this problem. Thickness is also problem, and thickness we all the time we deal with the thickness, right? PCOS and androgens and the pills induced thickness and all this is very common, and we are working on it already. So how much thick is the problem? 14 to 16 mm. I have written 16 mm here, but more than 14 mm is also a problem for the implantation. Okay, so more than 16 mm is also having poor prognosis for the pregnancy. So I hope the definition is clear. Okay, so we are dealing with thin endometrium. So here the uterus, and it is saying that give me more, I need nutrition, just enhance me, do something for me. Okay, I need to carry a baby. So what is the normal endometrium then? Normal endometrium, for our knowledge, it is normal 8 to 14 mm endometrium around the ovulation is good for implantation. Means there are 80 to 100% chances of getting pregnant in this thickness of endometrium. Okay, and I hope you're recognizing the background picture which I have put. It is of endometrium. That is not any wallpaper. So, okay. So this is the normal endometrium. See, initially we were not very much aware as well as very much like caring about the endometrial thickness and this different kind of calculations. But why now? Why now data is available and we're trying to like this much endometrium, that much endometrium, and what to do for enhancing this endometrium, the aggressive treatments and all. Why we're doing it? When we treat in with Ayurvedic medicines or the in Ayurveda way, we can say, or some traditional ancient modern medicine, traditional modern medicine. We never thought of this. Why now? It's just because IVF culture. Just to support the IVF span, to finish all the things in that particular span, we are all behind this corrections and technical things like we need this, we need that, because it is all technical problem, technical things. But it's not always like that. Okay. When we sit in the OPD and we see the patient clinically, it's not always ki aapko today we need to do endometrial thickness and after 2 days we need to give the embryo transfer. We do the embryo transfer. It's not like that. That is wo to bahut baat ki stage, right? Endometrial transfer and IVF is, first of all, when you sit in your OPD and you encounter with the patient having thin endometrium, simple patient, you are seeing the report and you are seeing that folliculogenesis is there, ovulation is there, but endometrium is not growing. Okay, that is the basic thing. forget about the IVF and all the things. We will go through the basic treatment and causes and all. But what to do now? How to treat? Because maximum of the therapies are non-conclusive. We will go through those, no issues. But it's not how much you read about it. It's about how much the people are promoting about it. Nowadays, you open any IVF centers, channels, or marketing websites and all, they will be like promoting the PRPs. Okay, they will say 50,000 mein we do, 1 lakh mein we do, this is only working, this will work. Of course, because behind that there are pharma people, they are doing that, right? A lot of things are there, right? But first of all, you need to think that whether you need to reach up to that stage or not, because it is not also conclusive. Even PRP is not conclusive. We'll go in next point. So I'm not saying this. I have quoted this from some article. I have given reference to that. It is still a challenge. One second, please. Okay, so treatment of thin endometrium remains a challenge, and future large researches are required to further elucidate an optimal management of patients with the thin endometrium. Right? So what are endometrium? If you need to evaluate the endometrium, what are the tools to evaluate the endometrium? So to know the health of the endometrium, we go through these markers like functional biochemical markers. Okay, it is a little bit boring, just bear with it, then I'll be coming to very good concept of the rasayan and all, very engaging concept. But this is basic information for some people, not for all. So please bear with this also. This is important. You need to know each and everything. Though you're not practicing it, you need to know these things to counsel the patients, to refer the patients maybe. Okay, then functional biochemical markers, इंटीग्रीन, इंटरल्यूकिन, साइटोकाइन, ये सारे फंक्शनल बायोकेमिकल मार्कर्स है जिससे हमें पता चलता है कि हाउ एंडोमेट्रियम इज वर्किंग. ओके, देन हिस्टोलॉजी ऑफ एंडोमेट्रियम वी डू, हिस्टोपैथोलॉजिकल एग्जामिनेशंस. देन अल्ट्रासाउंड, commonly non-invasive technique we do ultrasound, TVS, 2D or 3D. Then we go for Doppler study of uterine blood flow. Doppler study say what we get to know, how is the blood supply to the endometrium, how is the nutrition, how is the vascularity, how is the resistance and all. Then we can go for MRI, hysteroscopy, SSG, that is hysterosalpingography, hydrosonography, endometrial receptive array. So endometrial receptive array is the a process in which some molecular biology level process, some markers are evaluated to see whether endometrium is receptive or not. Endometrium receptive 1 या 2 दिन के लिए ही होता है in that luteal phase. Okay, but we are in peri-ovulatory phase right now. We're talking about the thin endometrium, endometrial issue, and peri-ovulatory phase. Okay, so these are the tools by which we do the evaluation of endometrium. Very commonly we do it by sonography. Primarily we do it by sonography because it is easily accessible, non-invasive, cost effective, and easy for patients too. Okay, and it is also very fast. We get it very fast. Like sonography, we don't have to wait for long to get the reports. So this is how it looks. And endometrial thickness, the maximum thickened area of the endometrial lining is measured while measuring the endometrial thickness. Okay, so what are the causes of thin endometrium? Now, as per the documentation, as per the modern science, I don't call it modern science, but for the sake of people, I have to call it modern science because we are also modern science people. Ayurveda is also becoming modern only. But anyways, so endometrial resistance to circulating estrogen. First of all, जो estrogen ovary से produce होगा, it needs to be there in the endometrium, of course, for the proliferation process. When there is endometrial resistance to the circulating estrogen, there will be inadequate estrogen, and again thin endometrium can be there. Then inadequate estrogen or decreased blood flow to the endometrium. एक तो decreased blood flow रहेगा या फिर inadequate endometrial resistance, uterine artery pulsatility index and all other बढ़ा दो. Then damage or injury to the basal endometrium. If there is any damage or injury to the basal endometrium, like in tubercular endometritis, chronic endometritis, Weger's curettage, adhesions, Asherman syndrome and all adhesions, and lots of things are there. Endometrium is not healthy, it is injured, having some infection, having some inflammation, having infectious or non-infectious conditions, history of severe infections and all adhesions, tuberculosis. ये सारी चीजें contribute to the poor endometrium, and then the growth is not possible somehow, and the resultant condition is thin endometrium. Okay. So what are the probable treatment modalities for the thin endometrium? Now there are a lot of things, as you can see. This is these are doctors, and this is uterus. And we are like, oh my God, we have so many treatments. Science is going on moon regarding this. As you can see, lots of things are there. Hysteroscopic adhesiolysis, hormonal manipulation by estrogen and GnRH agonist therapy, vasoactive measures like aspirin, just to increase the blood flow, tocopherol, vitamin E, pentoxifylline, L-arginine, sildenafil, to increase the blood circulation. Intrauterine infusion of growth factors such as GCSF, that is granulocyte colony stimulating factor, PRP, that is platelet rich plasma infusion. Hysteroscopically we infuse it like IUI, endometrium. Then recent application of regenerative medicine, that is stem cell therapy. I mean, latestly what is coming? Stem cell therapy. Stem cells are implant kari, and then the regeneration will happen. The new endometrium, the new endometrium will come and all. So these are the treatment modalities, but maximum of them are used combined, not a single therapy. Combined many maximum are used, and thoda research is there, like not conclusive, but it's not like 100%. This is the protocol for this. This is not like that. Maybe many more researches in upcoming decade, we will get to know what is failure and what is successful. So these are the things. You can go through the slide. So pregnancy residues, abortions, infections, virus, and adhesions, these are the causes of thin endometrium, and these are the treatment modalities. Ek overview hai, pictorial overview. You can go through it. So जो भी treatment I have just enlisted, okay, what they do, thin endometrium में what they do, they improve the vasodilation, that is uterine blood flow, directly endometrial blood flow, endometrial proliferation, angiogenesis, that is new vessel formations for the blood supply, vascularity, and endometrial receptivity. In the second phase, endometrial receptivity also will have a positive effect. Okay, and the successful implantation will occur. Fine. So overall, कोई भी drugs आप लीजिए, जो भी हमने अभी तक देखे, they will work like this, in this pattern. They will do vasodilatation, then proliferation, then vascularity will be there, good blood supply will be there basically. So nutrition will be there to the endometrium. Okay, and apart from this, stem cell therapy, that is regenerative therapy. Okay. Again, we feel that we have done so many things, and then we don't get results in maximum of patients, and we again get like. So this is also I have quoted from some research article. In spite of vast diversity of treatment, most of the options accomplish only minor in the endometrium thickness and subsequent pregnancy rate. So there is change, of course. We are giving something, there is change, but not at that extent, not 100% positive results of these treatment modalities. There is one scoring system called USSR, as you can see, that it is the uterine scoring system of for the reproduction. So this is a kind of biophysical profile of uterus. We do it in obstetric, biophysical profile of baby, or different parameters are there, and we do scoring. Like that only, we can also assess the biophysical profile of uterus. So overall, what we see in this criteria, we see the endometrial thickness, we see the endometrial layering pattern. Okay, that it should be 5-line layering, proper layering. We see the endometrial motion, that is contractions, whether it is normal or not. We see the myometrial echogenicity, how is the myometrium, whether it is homogeneous or heterogeneous or some extra infiltration is there. We see the uterine artery Doppler flow, that is any resistance is there. Okay, and we see the endometrial blood flow zone 3, 1, 2, 3, 3 zones are there. So we see the 3 zone blood supply. And then myometrial blood flow on the gray scale. So these are the parameters which we look in this scale and we calculate, and according to that we give the marks. Okay, and according to that we calculate them, and particular score will be there. For example, if the 20 is the score, then okay, there are very good chances of pregnancy, 100% or maybe 90 to 100%. If the score is like 17, 18 something, then there will be chances of 80%, 70 to 80%. Less than that, 14, maybe 60%. Less than 13, maybe 0 chance, because it's not healthy. The biophysical profile of uterus is not healthy. So overall, this is also a good scale to assess the overall uterine health, especially it is assessed for the endometrial receptivity. Okay, so this is also assessed. Maximum time this is done in IVF procedures only, because they can't take any risk. It is a costly procedure. Okay. Now let's come to the platelet-rich plasma. So whatever growth factors are there in the endometrium, which increases the endometrium, as we can see, the endometrium. We all know that endometrium is a mucosal layer, right? It is not having any submucosal layer. It is greatly exposed to the muscle coat of the uterus, right? So that is in arm language we call it 𝙃𝙃, right? Because it is complete a pure mucosal layer. Then endometrium is functional layer, and there is basal endometrium, right? The functional of the endometrium, which is exposed to the cavity, it undergoes the differentiation and shedding. This differentiation and shedding, that means degeneration, regeneration. So in that process, we need lots of growth factors and cytokines and all the enzymatic activities. And this process is enhanced by the platelet-rich plasma. So what PRP does this enhancement and then proliferation. It also helps in proliferation. Okay, so this kind of support is done by the PRP, and nowadays people are promoting it a lot. Not conclusive, but it is happening out there. Okay, so anybody can tell me here. I know I have asked to ask questions, but I am asking here. So anybody can tell me to which dhatu it can be correlated when we recall about the Ayurveda. If somebody can correlate, or at least what do you think? Which kind of dhatu is this? We are directly injecting it into the endometrial cavity. Anyone? No, not Mars dhatu. Yeah, it is not Mars dhatu. Yeah. We can you can correlate it with the rasa.
Rasa dhatu. Yeah.
Rasa dhatu. Yeah, rasa dhatu. So rasa dhatu is nothing. We'll discuss it later. Rasa dhatu is nothing but like works like this only. Okay. So PRP a little bit less expensive than a stem cell therapy, but can't replace stem cell therapy. Okay. So this is also done for the thin endometrium. Basically, initially, if endometrium is not responsive by various treatment, then only we go to this kind of treatments. If we are practicing pure modern medicine and we don't have Ayurveda option, or we can do the integration of the treatment. Okay. Now, initially, I forgot to talk about this, about the integration. Integration is not just about the concept, not about the medicine only, like give this aspirin and then give the shatavari. This is the integration. This may be the integration. Practically, I believe in the conceptual integration, hypothesizing the things, like diagnosing with these things, and finding the lacunas and filling it with another therapies. So concepts integration is also very important. And that's why I call it as a modern, we are modern Ayurvedic people. So we don't refer, I don't refer the Western medicine as a modern medicine often. And let's start this also. What say all of you? You also don't refer the Western medicine as a modern medicine, because we all are doing modern medicine. We are not giving swarasa anymore or the typical traditional things. Everything is modernized now. We are practicing modern Ayurveda, modern integration, modern allopathy. So we are all modern people. So just don't use that term modern science for other people. You can replace it with the Western medicine as you wish, after all. Okay. I hope I'm not going fast. Dr.
No,
Sujata,
absolutely
Dr.
not.
Meenakshi, no.
Absolutely not.
Thank you. So regeneration therapy or stem cell therapy, a very favorite thing going on nowadays, and extensive research is going on this. So let me introduce the stem cell verbally to you. So stem cells, they are the cells which are omnipotent and pluripotent. ऐसे उसके दो types होते हैं. Like embryonic stem cells are there, and then adult stem cells are there. Like zygote, for example, after fertilization, जो zygote बनता है, that zygote is able to produce whole human body. So it is omnipotent. Okay, also called as omnipotent, right? So, and the other cells, like for example, cells in our body, for example, cells in bone marrow, they are just capable of creating the other cells, white blood cells and platelets. So those are multipotent. Okay, so these are the basic difference in the stem cells. So every human body has stem cells, which are undifferentiated. Okay, each and every dhatu, our body is having stem cells, which is not differentiated. Okay, but it has that capacity to regenerate, and this genetic phenomenon is taken by the technology. And now what they are doing, they are deriving that cells, taking out. They are doing some exposure of different substances, ascorbic acid and all other, depends on the tissues. Okay, and they are making it differentiated, and they are then insulating or infusing into the affected area. Okay, so this needs a particular exposure and some procedures on it. Then what is the concept of regeneration in Ayurveda? Okay, so anyways, we have the regeneration in the form of rasayana. Okay, so how it works then? So basically, the undifferentiated cells in the body are already gets differentiated and activated by the different rasayana which are already mentioned in our ancient texts. And these rasayana are tissue specific. If you go through the rasayana, like for example, if you vrishya rasayana, then 100% it is for reproductive cells. That means that rasayana is having capacity of regenerate or reactivate those things. Okay, expressing the genes and chromosomes and all. Whenever there is no regeneration, what can be the reason? Genetic issues can be there. Okay, but stem cells has that potential. Stem cell has that potential to even express the genes. So there are lots of possibilities. So rasayana therapy of mentioned in the Ayurveda, of course, it should be used cautiously, not every rasayana on everything, but at dhatu level, like the reproductive, vrishya rasayana should be used only for the reproductive things. Okay, then rasayana which are advocated for the rasa should be used on that only. For example, guduchi, I'll give that list too. So these are the obviously now in India we can't directly go for the stem cell therapy. Practically speaking, in your OPD you're sitting, you can't just prescribe it to the patients, at least for maybe 10 to 15 years. And the research will be there, then it will be cost effective, and then it will come in India and at your periphery level. Tab tak to you will be retired. You will not enjoy your current practice, right? So for now, at least for now, it is needed. I don't know in future. So whatever we are taking, in coming slide I have explained it. Okay, so what rasayana does? Enhancement of rasa, that is essence, increasing the essence of rasa. So thin endometrium, when we think about the thin endometrium, we think about the menopausal condition, because menopausal women are also having thin endometrium. Okay, and that condition is Zara condition, and rasayan therapy is Zara chikitsa also. Rasayan therapy is Zara chikitsa also. Geriatric medicine. Okay, so thin endometrium, if we consider it as a vata pittatma condition and menopausal condition, it is induced menopause. Thin endometrium is nothing but the menopausal endometrium, practically. Okay, so what rasayan does? Enhancement of rasa, tissue regeneration and cell renewal. Medhya drugs, for example, neuronal stem cell differentiation. These are the researches. In Medhya drugs they have taken, and then they did the neuronal stem cell differentiation. First, पहले क्या होता था कि stem cells जो होते थे, for example, liver cells liver को ही बढ़ाएगा. Okay, then kidney cells kidney को ही बढ़ाएंगे. Bone के cells जो है वो bone के cells को ही बढ़ाएंगे. Hemopoietic cells hemopoiesis ही करेंगे. एक ऐसा research का उतना limitation था. But now what happened? That process is called as plasticity or plastic process. कि अभी every cell is capable of making another cell also. Like liver cells can make the stomach cells can make the neuronal cells. This kind of things are happening now. ये जो concept है, ये concept भी धातु का concept है. Rasa to rakta, rakta to mass, mass to weight. This concept that rasa is having the stem cell of rakta tissue, blood tissue. Hemopoietic tissues is having the stem cell of massa. So we don't need to do any research. We just have to look for the over 200 rasayanas given in our text and differentiate it, classify it, and see on which dhatu it is working and give it to it. Now we know that Raja is related, Raja is related to Rasa and Rakta. So you find it and you work on Rasa and Rakta for the endometrial thickness to enhance the thin endometrium. Okay, fine. So we are famous, Ayurvedic people and Ayurvedic medicine is famous for degenerative diseases. Arthritis, Parkinson's, and Alzheimer's disease, and all degenerative diseases. That means we do regeneration, of course. If we are treating degeneration, means we are doing regeneration. That means somehow indirectly we are working on these things only. Okay, and also whenever we take this rasayana, this is having some tissue specific activity. It's like if agar unko endometrium pe hi kaam karna, that rasayana will go to the endometrium only. That is called the specific tissue affinity. That's why they are categorized. That's why indications are important. कि आप वो कहाँ दे रहे हैं? Because each and every medicine, even in modern, has tissue specific affinity, and it will work on that injured things only. If there is infection, ulceration, injury to the endometrium, it will go and work there only. Okay, so how come Ayurveda approach थोड़ा सा देखिए अगर endometrial thickness की तरफ, then Vata does regeneration, Pitta does aromatization, and Kapha does secretion. Okay, now what is aromatization? Anybody? Yeah, anybody, you can tell. Initially I told you, I lied to you that I won't check the chat box, but I am checking it. Anyone? Blood supply. No, aromatization is the process, reproductive process happening in the endometrium, happening in the genitals. Aromatization. Yes, anyone? Aromatization. Pitta is doing aromatization in the endometrium. Okay, so I need to work on Pitta, but what is aromatization? Yeah, conversion of androgen to the estrogen. For endometrial growth, we need estrogen. Estrogen kahan se aata hai? Conversion from the androgen. And that process is called aromatization. So any conversion process, enzymatic actions, metabolism is predominantly related with Pitta. So Pitta has this role. And Kapha has all the secretory activities in that particular endometrium. So basically, all doshas are involved. But when we talk about the abnormal condition like thin endometrium, we talk only about Vata and Pitta. So some people who think like that, they will directly ask which samprapti, which dosha are involved in thin endometrium. So straightforwardly, broadly, we can think of Vata Pitta condition. Treat Vata Pitta condition in follicular phase, and you will find endometrium, thin endometrium is not a big issue in Ayurvedic treatment or integrated. Even in yoga, there are very good postures too. In last slide, I will show that. Okay, so in Yoni Vapat, lots of medicines are there. You just search for Vata drugs, Vata Pitta drug, Shushka Yoni Vapat. Okay, Shushka Yoni Vapat, Vata Pitta Yoni Vapat, Arajaska Yoni Vapat. Now take those drugs and treat the thin endometrium. You will get the results. And along with that, you want to use tocopherol, you want to use aspirins and the modern medicine, you can go for it, no problem. Just look the adverse reactions and the interactive things and go for it. Okay. So what should be the focus while treating the thin endometrium? First, rasa, that is nutrient effect, because modern medicine is all talking about nutrition only, increasing the blood supply only, right? So rasa, increase the nutrient effect. Agni, metabolism should be good. And strotas, that is the micro circulation, vascularity, work on that too. Circulation, micro circulation and tissue perfusion. Okay, so this is the protocol. This is the way of thinking, the treatment approach. Okay. Now we have some unique drug delivery system. Now unique drug delivery system, why unique? We have suppositories and all in modern also. In Western medicine, they're offering the infection, suppositories for infection, progesterone, hormonal suppositories and all. But we have these procedures, okay, and which is not just for infection. Maximum people talk about Yoni Dhawan and Pichu and Yoni Dhupan and all just for infections. Infection is a very preliminary thing. So it is very basic thing, right? First of all, we need to think that route as a drug delivery route. Vaginal route is for drug delivery. And PRP, stem cells, endometrium, we are approaching endometrium through vagina only now. These procedures are local procedures only, right? So these are the delivery system, use it for the other medicines also. So vaginal route like Pichu, you can go for Pichu, different oil soaked Pichu. And then uterine medication, if you don't understand Uttar Vastu. I know, I'm kidding, everybody understands it. Intrauterine medicine, rectal route, that is normal basti, common basti, and skin route. Skin is like local abhyanga, Swedan at particular time and deep level. It is also acting like good route. Because see, when we go for estrogen therapy also in thin endometrium, we use local suppositories and transdermal patches and creams and all. We use that skin route also. Okay. So in Ayurveda also you can go for the skin, these routes. So these are the drug delivery routes for the different drugs. Now just for thin endometrium, as our topic is thin endometrium. Okay. So what is the mode of action of this drug? Drugs, how it works. Vaginal mucosa, everybody knows. Okay, so it is having lipophilic action, means the lipid affinity, hydrophilic action too, the aqueous affinity, water affinity. Okay, transcellular absorption and paracellular diffusion. In those three cases, there is drug delivery into the vagina or through the vagina to the genitals. Like you can see in this picture, between the cells, there is diffusion called paracellular diffusion between the cells, absorption. So this is one kind of diffusion, and second is direct transcellular pathway through the cell. It is going through the cell and then ultimately reaching to the target. As I told you, it will reach the target. If there is pathology anywhere and you are giving the proper drug which is indicated, properly made, will reach the target. Okay, so this is the action. If anybody I think this may, okay, anybody wants to ask about this, we can go for in last. So in this way things work. Now what is lipophilic agent? As I said, that lipophilic drugs. So whatever oil or whatever ghee, medicated oils or medicated ghee we give, this is nothing but lipids, and vagina has a great affinity. Vaginal mucosa has a great affinity for this kind of medium. This and there is good absorption through the ghee and through the oil. Okay, now I'm not going to tell you that what are the ghee and what are the oil. This everybody knows that, and everybody is going to the same things. We are focusing on the conceptual stuff more. Okay, as you can see, the vaginal, rectal, and bladder connectivity, almost whatever it gives to the rectal route, vaginal route, or the bladder route, maximum times interrelated. They work because the covering is same, and that's why the matra basti, that is the rectal basti, the rectal installation of the medicine, medicated oil, will also work wonders for the uterus also, literally. And in my practice, what I see is rectal basti as a boon for the gynecology. I don't know about rest treatments, but for gynecology, it is boon. Even in immediate emergency conditions also, it gives wonderful results. Okay, so for thin endometrium, if we go for the rectal bastis, uttar bastis, pichu of different drugs, it works in that follicular phase. So as I already told you, this should be considered as a broadly, loosely, it should be considered as a, I consider it as a Vata Pitta condition and Arajaska like conditions. So if you see the Arajaska symptoms and treatment, there is one research also on the 𝙀𝙃𝙄𝙉 tablet, that endometrial thickness has been increased. There is one another research of 𝙀𝙃𝙄𝙉𝙀𝙃𝙄𝙉. 𝙀𝙃𝙄𝙉𝙀𝙃 is instillated in uterus, that is Uttar Basti, along with the Baladi Churna is given. So that 𝙀𝙃𝙄𝙉𝙀𝙃 also increase that biophysical profile and the endometrial thickness. So 𝙀𝙃𝙄𝙉𝙀𝙃 is indicated in Pitta condition in text. If you go for the text, sometimes by the results we get to know the diagnosis. That means it is having some good Pitta involvement. Okay, and how this Vata or neuronal system is involved in the thin endometrium. Nobody's thinking about neurons and nerve cells in modern. We have seen the pathophysiology. Nerve cells. Where are nerve cells? Have you seen something in that uterus biophysical profile related to nerves? Anyone? When we saw that criteria, biophysical profile of uterus, anybody noted the involvement of nerves, Vata? Yes, anyone? Any parameter? Motion of the uterus was there. Motion, contractions. In biophysical profile, one parameter is there of contractions. Contractions, totally neuronal activity, totally Vata dependent activity. Means for that particular endometrial health, we need that normal contraction also. Okay, that's why it is, treatment also suggests that it is a Vata Pitta condition predominantly. Yeah, and also the pregnancy drugs which are given in pregnancy can be advised in thin endometrium. How? Why? Because anyways in pregnancy we are working on the good endometrium, endometrial enhancement, nutritional support and all. So you can give, and Vata Pitta Shamak drugs are there. So in pregnancy, drugs can be easily used in thin endometrium. So whatever your now in Garbhini Paricharya or other drugs which are indicated in Garbhini or pregnancy, you find it, you make a list and you try it in thin endometrium and you see the results. And results are very easy to see. You just have to go for the follicular ovulatory sonography. That's it. Okay, so specific examples, there are some specific examples like so there are various drugs, but just to discuss at conceptual level, Phalagrita, Pushpadhanva, Hingu, and Garbhaprada Yoga, I'll talk about. Phalagrita, first of all, there are two types of Phalagrita, India Ashtangrada and then, sorry, Ashtang Sangraha, it is given and it is in, one is in Sharanghar. Okay, so Phalagrita, the name itself is suggesting Phala. Now again on the physiology, Phala and Pushpa. Okay, Pushpa is ovum, that is beach, follicles, everything happening in ovary, seeds, and also the endometrial lining, because when it gets out, the menstrual blood is also called as Pushpa. Okay, and that's why when we talk about the ovary, AMH, and follicular genesis and all reserve, increasing reserve and all, we think about Pushpadhanva, but you can also think Pushpadhanva regarding the endometrial linings, because after all it is Pushpadhanva, it will enhance the Pushpa. Endometrial lining, which is regenerating every month, undergoing the cyclic pattern, is also Pushpa. Hingu, if you go through the text, it is Pushpa Janana. So Hingu can also be Hingu involving ingredients, the combinations can also be given, Hingu structure can be given. And Garbhaprad Yoga. There is one research also on this yoga, and I use this yoga a lot, and this is a beautiful yoga for, especially for the thin endometrium. You can also try it. So anyone, what is the Garbhaprad yoga? Like you have read it somewhere, or anyone? Garbhaprad yoga. I am asking it because it is very simple combination and you can give it at basic level. It is not having like too much ingredients, and it is just Trikatu and Nagakeshar combination. Trikatu and Nagakeshar combination, and it is called as Garbhaprad yoga. You can give it in the follicular phase with Ghrita, Go-Ghrita. Okay, and I have seen that endometrial enrichment in endometrium due to this yoga also. So you go for the history, because when patient comes to us, we go for the darshan, sparshan, prashna. You go for the prashna. History taking should be very good. You use the modern tools. You go for the diagnosis, you evaluate the patient properly, you go for the biophysical profiles, you do PV, PS, sonography, do everything, and see whether there is history of infection, any drugs, inflammation, adhesions. Is there any local estrogen resistance? There is less vascularity or inadequate estrogen, and you can treat the patient according to that. Okay, if there is history of infections, torch is there, tuberculosis is there, go for the wound healing things, with the stomach things. Okay, first line of treatment should be antimicrobial. Patient will tell you, usne antitubercular therapy bhi leke wo aayi hai patient. Then too you need to work on the residuals. Endometrial tuberculosis or tubercular endometritis. We don't know. Patient comes to us because of the less diagnostic availability of diagnostic tools, and we don't often evaluate those patients. Okay, but this is very common, and it has a wonderful Ayurveda or the Pasti or the medicines have a wonderful results on the tubercular endometritis. Initially, the patient comes with the menorrhagia, active tubercular endometrium or genital tuberculosis. Patient comes with the menorrhagia and these things. But after thin endometrium, patient comes with scanty menses. So, what are the clinical symptoms of thin endometrium? Basically, mainly it is scanty menses. Okay, scanty menses, hypomenorrhea, irregular menstruation. Sometimes dysmenorrhea also. Okay, so you can go. And adhesions. If there are adhesions, like we go for adhesiolysis and then PRP and all there also. But the local ksharabasti is also very effective in adhesions. If there is history or re-adhesions forming, you can go for the local Kshar Uttarvasti. Diluted Kshar Uttarvasti, like 1 ml of Apamarga Kshar and then mixed with the Dashmi oil, and not direct whole Kshar oil. Okay, so you can go like this. And there are various combinations which contains the drugs like Piper. I just want to, many of you must be knowing this, but still let me tell you that bioenhancing is important. Strotoshodhan, we talk about the strotoshodhan. Okay, there is raised pulsatility index. There is resistance for the nutrition in the endometrium. Now go for the strotoshodhan. What are the strotoshodhan drugs? Drugs containing the pipili, marich, strotoshodhan, Piper. Now when we go to the researches, Piper longum and Piper this marich, your marich, Piper nigrum, these drugs are bioenhancer. So whatever you are taking with medicine, they are there to enhance their absorption 100%. So lipophilic activity is also there of whatever you're giving, ghee and oil, and then this Piper and all drugs are also there. So there is no resistance. Resistance can't stop Piper, and as it is strotoshodhak, so there is no issue. Also, that's why I told you the endometrial evaluation. You should know, okay, there is raised pulsatility index of uterine artery, means there is resistance. So you should know what to do now, how to approach. Okay, I hope you're getting it. We already talked about it. So this is a chart, you can note it down also. These are the rasayana, specific rasayana, like Guduchi is working on the rasa. Piper longum, Pipli is working on the rakta tissues. Shatavari is working on the masa. Haritaki is working on meda. Gugul, that is mukul, Comifera mukul is working on asti. Bacopo manila, that is Brahmi, working on majja. And Vidania somnifera, that is Ashwagandha, is working on shukra. Shukra is the dhatu in the body which contains genetic information. है ना? तो शुक्र जो शुक्र से भी अभी काफी स्टेम सेल्स, स्पर्म से काफी स्टेम सेल्स अभी डिराइव करके they are making different cells. Okay, so these are some drugs which are particularly acting on the this dhatu. There is one research just would love to share with you. So this is amla, that is Phalanthus umbilica, fruit. Then Shoria robusta, that is shal, and Yasudha bhasma combination have shown activities in wound healing, fractures, anemia, corneal ulcers, brain, and these things. Okay, in the damaged things. So these are the herbs. Okay, and these are the evidences, like they are working like stem cells in wound healing. Dhanvantar Kashai. Dhanvantaram Kashai is a gynecological drug. Mostly, it is used in other things also. So this is research regarding this Dhanvantar Kashai, that it is a decoction of herbs having regeneration property. It was demonstrated activity in Wharton jelly mesenchymal stem cells. So decoction increased the proliferation rate, decreased the turnover time, and also delayed the senescence, means the aging of the cells was delayed. Proliferation rate was increased. Turnover time was decreased. So regeneration happened. So what PRP is doing, Dhanvantaram Kashai is doing, and this is research based. So we use these medicines in infertility while treating, but we don't know we are directly working on these things. Indirectly working on endometrium. We use these things. We especially Dhanvantaram Kashai we use in postnatal for regeneration, for gaining the pre-pregnancy also. In postnatal things, infertility also we use it. But we don't know, whatever we are using, we must know that we are working on what factor, ovary, endometrium. For that, you need to collect the data and now have keen observation of whatever we are doing and whatever we are getting. We need to make a good documentation for it. So these are the indications of Dhanvantaram Kashaya. Sutika Rog, Bala Rog, Yoni Rog, depletive diseases, Shaya. And drugs like this, many drugs, this is just example because this is researched. Madhumalini Vasantarasa. Now, as I told you that some drugs which are used in pregnancy, you can go for thin endometrium also. And Madhumalini Vasantarasa is also one of the drugs which works in pregnancy, Dubruhana, officially documented in ANC. So you can use it in thin endometrium too, and this kind of patients too. Okay, with Grita. Mahayograj Gugul is also, it is mentioned for dysmenorrhea anartha, that is scanty menses, the classical symptom of thin endometrium. You can go for this also. And Gugul, as I told you, this is Rasayan also. Okay, now Sitopaladi. Ye kahan se aa gaya Sitopaladi? Sitopaladi has some good references in our text, that it is given in IUGR, intrauterine growth retardation. Sitopaladi is given. So the concept is, if it can be given in intrauterine growth retardation, means what? Intrauterine growth retardation के drugs वही करते हैं, vasodilation और जो हम यहाँ thin endometrium में कर रहे हैं, right? So Sitopaladi is indicated there. Then why can't we use the Sitopaladi here? Also, it is Daha Shamak. If you go to the shloka of Sitopaladi indication, it is not. It is Deepan also. So that drug, forget about the Ayurvedic concepts. If you are not interested, forget about it. But you know that it is given in the IUGR. It can be used in thin endometrium too. You can try Sitopaladi also. So I told you, whatever is used in pregnancy, in diseases also, pregnancy diseases also, you can try out it in thin endometrium. Just the one condition is it should be Vata, Pitta, Shamak predominantly. Okay, so I was talking about Phalagrita. Phalagrita everybody is using, very common, broad spectrum, like it got, there's a broad spectrum antibiotic use hota hai, वैसे broad spectrum antibiotic, sorry, broad spectrum infertility drug I call it. So timings Ashtang Sangrah में जो है timings बताया है, it should be given in follicular phase, during the follicular phase. And there are different indications like menstrual disorders, you give in menstrual disorders and yoni rog and all, but there are special indications also like abortion, stillbirths, neonatal deaths. Poor endometrium, suggestive of poor endometrium, bad obstetric history, abortions, stillbirths, neonatal deaths. Okay, so you can use this concept in thin endometrium directly. So it is working on the poor endometrium, that's it. In Sharangdhar, it is advised in Pittaja Yoni. That's why I and that research also, it's also used in Pittaja Yoni. Phalagrita should be used in Pittaja Yoni. Thin endometrium somehow suggesting the Pittaja Yoni. You can go for Phalagrita with evidence. Okay. Then Shandhi Yoni. Sharangdhar says that it can be used in Shandhi Yoni also. Now, Shandhi Yoni is having congenital issues, chromosomal issues, genetic issues, underdeveloped organs. Okay. And Phalagrita is advised in it. So underdeveloped, pick that word. Not develop means regeneration, growth, genetic expressions. Then Phalagrita should be given in thin endometrium. So in this way, in this logic, we can go for it. Now let's, in this regard only, I'll talk about the hypoplastic uterus. Hypoplastic uterus, uterus size less than 4.5 classically. Okay, so that is hypoplastic uterus. In modern, in Western medicine, there is no much to do in this. Okay, uterine transplant is the option, but in Ayurveda it is not that big deal, because hypoplastic uterus, when we treat with good indicated Uttarvasti and other drugs and medicines, the result is excellent. It's not a tall claim, results are good. Hypoplastic uterus, it grows with the Ayurvedic medicine, with the early intervention. Okay, so this is the capacity of these medicines, is hypoplastic or hyperplastic. So we just need this phenomena in endometrial growth also, in thin endometrium also. So use these concepts whenever we read drugs and indications. We also read the other indications related to, not just yoni rog hai to apna hi dekho, baju ka mat dekho. See to other things also. अगर आपके इंडिकेशन समझ में नहीं आ रहे तो बाकी इंडिकेशन समझने की कोशिश करिए, तो आपका वो ड्रग आपके इंडिकेशन में कैसे काम करेगा, we get to know. And as because of kripa of the new era and all the diagnostic things, we know where is the problem, so we can directly work on that, right? Rasa Pachak Bhatti, as I told you, Rasa. stem cells. Rasa se hi artha, very basic concept of Ayurveda. Rasa Pachakvati also works good in endometrium. Patol, Kutki and Kutach is the content. And you can try, use this also. People isko use bhi kar rahe honge. And there are some yogic postures to increase the blood flow. Okay, these are just examples. This kind of exercises, like when you're practicing, you're giving treatment to the patient, integration, you do the therapeutic integration too. So these postures are also supportive for the adequate blood flow to the endometrium. Okay, so I hope I was able to convey my thoughts to you. So that's it from my side. Thank you so much.
Wonderful session, ma'am. It was very nice, up to the mark. And the best thing is about you said about what is the proper integration. Yes, it is means we should think in that way. It's not just about what the medicine you are giving. It's not absolutely like that.
Yeah.
Proper diagnostic methods are always has that importance to reach up to the diagnosis, and one should follow this. You should not jump on the treatment.
Hey, Pari.
Yes,
Pari.
absolutely.
Sujata ma'am?
Yes, ma'am. Now can we start question answer session, ma'am?
Yes, please.
Okay, ma'am. So some questions are there. First one is, does endometrial receptivity and endometrial thickness are related with each other, or it is different?
Not much. Endometrial receptivity is a total different process. It may affect the poor endometrium, excellent endometrium. As I told you, the biophysical profile, right? It should be good. The endometrial receptivity is a process which is a window period, like 1 to 2 days. There are some changes in the endometrium just to do that implantation process. So it is, of course, it will get affected with the thin endometrium, no issues. But is your question is about thickness or thinness?
Ma'am, thickness. Endometrial receptivity and endometrial thickness.
Endometrial thickness loosely has very much less to do with the receptivity. The receptivity is ultimately the mechanism and the potential of taking that embryo, and it's just a measurement, thickness and thinness. It can be a quality endometrium too. So it has less to do with, in my opinion, whatever I have read.
Okay, ma'am. Ma'am, next question is with the growth factors and receptors. Which growth factors and receptors play important role in endometrial development?
As I already mentioned in my PPT, the growth factors in endometrial evaluation, I have enlisted it. And I have also mentioned the colony stimulating factor, granulocyte colony stimulating factor. And there are a number of growth factors.
Yes, ma'am. Yeah. Ma'am, next question is, please explain in detail causes of thin endometrium in puberty and in reproductive age. You explained
in
reproductive age, ma'am, but the causes during puberty. What are the causes during puberty?
Genetic, as I told you, regeneration failure, true thin endometrium. True endometrium, not secondary, primary thin endometrium. The 100% has to do with genetics, chromosomal deletion, non-expression of genes. Regeneration के लिए जो genetic information चाहिए वही नहीं है. In endometrium, what happens? There are receptors, right? Receptors होते हैं ना endometrium में. Then, and what they do when estrogen comes, चिपक जाते हैं. There is genetic down regulation and up regulation for the regeneration. So there is issues in the congenital issues only. There is genetic issues or maybe some congenital structural deformities.
Okay.
That can be the issue.
Okay, ma'am. So, ma'am, does controlled ovarian hyperstimulation make any adverse effect on endometrial receptivity? Yes.
Clomiphene citrate has a very bad effect on endometrial receptivity as well as the growth, because it acts as anti-estrogen and it hampers proliferation basically. And we just want proliferation to treat the thin endometrium.
Yeah.
So it affects.
So, ma'am, how long can we use clomiphene citrate?
We use it as per your protocol. if you are using clomiphene citrate. But now also, if you are using clomiphene citrate, I mean, there are newer drugs. So
yeah, letrozole, like
better than
letrozole.
that.
Yeah. Yes. Ma'am, can you please explain
And one
Doppler?
more thing I wish to add, that clomiphene citrate, whatever conception occurs, there are high abortion rates too.
Yeah.
We just see that patients like, okay, conceived, wow, but the follow-up is needed. Further anomalies, stillbirths, neonatal, further developments, there is huge issues with it.
Okay. Ma'am, please explain Doppler readings related to endometrial circulation.
We have gone through those slides. The endometrial
Yeah,
evaluation, yeah.
Yes.
So there is hypoechoic conditions in Doppler. What we see, the vascularity zone 1, 2, 3, and we see the hypoechoic things. And Dopplers are also having now different the newer technologies are coming, higher technologies are coming. So we see the blood flow. That's it. And also there are other criteria also, like 4 vessels only, 3 vessels only. So either there is less blood supply, or either there are less blood vessels. So we can see this on the Doppler.
Okay, ma'am.
Dr. Gopal,
ma'am?
raised his hands. Sujata ma'am,
Yes.
someone wanted to ask. Dr. Gopal, please.
Okay.
Ashoka. Yeah. I read this question. So, Dr. Gopal, your question is, please explore about action of Ashoka plant on endometrium. So now, how I integrate this thing. Ashoka is, if we consider it as is anybody, which Gana Ashoka is?
वेदना स्थापन, I think.
Vedana Sthapan, that's it. Vedana is nothing but inflammation, right? Prostaglandins, Vedana, pain. We have to work on the Ashoka is anti-inflammatory, broadly, loosely. Okay, because he has asked me to explain the action in the modern language. So anti-inflammatory. Endometrial receptivity, we have already seen the causes. Inflammation is a major cause, right? So Ashoka can work in that way, in the inflammation. Just one segment I have explained.
Ma'am, one more question is there. Explain your idea on the hypoplastic endometrium secondary to tubercular endometriosis.
Okay. Hypoplastic endometrium, hypoplastic means thin endometrium, you want to say? Thin endometrium, right?
Yes.
Yeah, tubercular endometriosis. It is tubercular endometritis. I hope I'm right with this, because tubercular endometriosis. Yeah, tubercular endometritis. There is adhesions. There are different phagocytosis action there, and infection, inflammation. The post-infection effect is there.
Yes.
Adhesions is there. Lacerations are there. Injuries are there. We go for the runner open, Uttarvasti, oral anti-inflammatory drugs. Whatever we are giving, like in thin endometrium, when we go for rasayan like ashwagandha, shatavari, vidari, shirapak, ghrita, we don't know. We just talk in the sense of like bruhan, ranaropak and all. But these are all anti-inflammatory, antioxidant drugs. If you can see, we also give the antioxidants in the thin endometrium. Majority of herbs, when processed with the ghee, works as antioxidant. Brilliantly, they work as an antioxidant. One more ghrita, there are a number of remedies and treatments. One more ghrita is the Adimadi ghrita, which I forgot to mention. The Adimadi ghrita also works very good in thin endometrium if you give it in the follicular phase. I hope this idea got clear. Tubercular endometritis, like any other infection, it will cause the same thing. Same picture is there.
Okay, ma'am. So with this management, can tubercular endometrium is reversible?
No, but ethically, if it is active, we need to give them the standard therapy.
Okay, ma'am.
Yeah, we can active genital tuberculosis treatment. I have like active, if it is active, we have diagnosed it, then that is mandatory. Like in ANC, we give iron calcium. Officially, we need to, like when we take any research projects, we mention that we give. Practically, I don't know. I may not reveal whether I give it or not, right? But these are the national programs,
Yes,
so we
yes.
have to follow that thing. But the post effect of endometrium, if you ask them to take standard treatment, and after that you take care with Ayurveda medicine of that the mess the tuberculosis has created, you can take care of it very effectively. 𝙀𝙃𝙀𝙊 𝙀𝙃𝙄𝙉 oil works best in thin endometrium and this tubercular induced endometritis. 𝙀𝙃𝙀𝙊 𝙀𝙃𝙄𝙉, all the drugs are very beautifully, they work. In
Yeah,
post
I usually prefer this 𝙀𝙃𝙀𝙀 𝙀𝙃.
yeah, best drug.
Okay, Dr. Rahul Kamde wanted to ask something. Please, Dr. Rahul.
Ma'am, this is question from Dr. Rahul Kamble. Have you got any success in tubercular endometritis?
Yeah, that's why I'm talking. I work, I practice Ayurveda, but with less tall claims.
One should be transparent like you know.
Sorry, ma'am.
One should be like a transparency in this, means like you.
Of course. In medicine, there is everything, maybe, may not be.
Of course.
When you go for the researches, nothing is confirmed in Western medicine, nothing.
Absolutely.
Not conclusive.
Not even that PRP, not even that stem cells. People are just doing it in their, they are just doing it, but it's not applicable for all patients, or it is not as a standard one to follow.
Even ma'am, I would like to tell you that and everyone that the standardization is not there. Like PRP, the methods of preparation, how much dose, and the standard SOP, the standardization is not there till now in that PRP. So we can't.
Okay.
It will need maybe more than 10 years.
Yes, ma'am. This is a question from Dr. Jyoti Dalal, ma'am. How PRP is beneficial for endometrium, thin endometrium?
I have explained it, but again I will tell you that the growth factors which are already working in increasing endometrium, PRP just enhance that, regulate those growth factors, sometimes induce those growth factors, and helps in proliferation of endometrium.
Okay.
This is the tentative hypothesis. It may do more in research, we'll get to know in future.
Okay. One question from Dr. Shivani Gupta. Treatment for hypoplastic uterus with absence of secondary sexual character.
This is a talk of thin endometrium. No. With absence of secondary sexual character.
Like to go to the genetic chromosomal again.
At what age?
Second chapter will start.
Yeah. In what age is important? Of course, there are limitations, but age is also important. 16 years. Wait and watch. Try to give these things, Bruhan Chikitsa, and wait and watch for 2 more years. Let's see.
Okay, she said, ma'am, 16 years. 16 years.
Go for the whole profile, hormonal profile, and all the chromosomal syndromes and the sonography, basic sonography, absent uterus and all.
Yeah. Good evening, Dr. Pratiksha. This is Mahi here. Wonderful presentation. Good to hear.
Wow. Thank you, Dr. Mahi. Thank you.
You.
I was not aware you are here.
I am here. I just had a question. Since you have I think you have a very good concept of many different things. I would really want to know your practicality and thinking about adenomyosis. How do you go for it? And maybe let's take the age of about above 45 years. Premenopausal.
Yeah, very good question. And this is my favorite topic, adenomyosis. Basically, when we talk about endometriosis is growing the endometrium outside the uterus and other body parts, right? So in that sense, adenomyosis, just for other people, adenomyosis is endometrial filtration in the myometrium. Okay. That is the adenomyosis. So Ayurvedic concepts is like, I correlate these things with Udavarta, because the infiltration is a Vata process. Normal चीजों को अपनी जगह पे रखना is a basic attribution of Vata. And if it is going here and there and retrograde, this means that Gati is disbalanced. So Vata is doing these things. And if it is going backwards, infiltration in the muscles, endometrium, Udavartan of Vata is happening. So you treat it with Vata, dominantly Vata condition and associated with the condition. So I correlate these things with maximum loosely with Udavarta Yoni Vapar.
Okay, thank you.
Thank you, Dr. Mahi, for being here.
Welcome.
We have
ma'am,
plans and we'll do that. Okay, I remember.
Yeah.
We can
Ma'am,
have a
one
next
more
session on adenomyosis, है ना?
Yes, ma'am.
We can have next session on adenomyosis.
Yeah.
I'm just ready.
Actually, there are people expect lots of drugs and all the list and all these things. But let me tell you, no drug list helps in treating the patients. While treating the patients, you need to have that thought process only. Just developing thought process. That's it. You can just have 2 to 3 drugs and you can treat the patients.
Yeah. You have that different. You should be on that different angles of approaching towards the diagnosis.
Yeah.
That is
less medicines, more thinking on that patient and diagnosis.
Yes.
Okay, ma'am, what type of chikitsa should be there in traumatic or diseased endometrium and thin endometrium due to hormonal deficiency?
Yeah. Hormone deficiency means estrogen deficiency, as I told.
Yes.
So you are talking about
adequate circulation, adequate perfusion. Again, increase the transfusion circulation by strotoshodhan and all drugs. Lipophilic agents, use ghee. Ghee is a very good drug, a very good medium. जो female होती है ना, women, they are sukumar. So don't use hard chikits on them. They are very tender. Their body is tender. So take it tenderly. Okay, give the medicine in shirapaka, in ghee, in oils, in less dose, and this will work. So don't go hard and prefer ghee as much as you can.
Okay, ma'am. Ma'am, next is please share Uttarbasti protocols for improvement of endometrial receptivity in case of thin endometrium.
Okay. Share means now.
Ma'am, please tell us.
SOP.
Yeah.
Okay. SOP in the sense standard operating procedure of Uttarbasti.
Yeah.
We there's no SOP. Nobody is the difference of opinions. Like some people say that Uttarbasti should not be performed. Ayurvedic people. Some people say that it can be, because Uttarbasti, intrauterine Uttarbasti is not as such mentioned in Ayurvedic text, right? It's just vaginal Uttarbasti. So if we are not very much aware of doing that Uttarbasti and all intrauterine, and you're ready to take risk, or you're following all aseptic precautions like autoclaved oil or ghee and all, then only go for that Uttarbasti. Otherwise, the vaginal pull, the vaginal basti will also work. If we go with the syringe and put that takiya under the back, it will also work. Vaginal basti also works.
So, ma'am, which is more significant, intrauterine or vaginal?
Of course, intrauterine. Of course, on intrauterine, very, very good and fast results.
Yeah.
But tissue or vagina also have good results, but Uttarbasti is like very fast results. I mean, in recent 3 months, recent 3 to 4 months, my 2 patients conceived after 3 cycles of Uttarbasti, immediately in 4 cycles. They conceived just because of Uttarbasti. And believe me, I don't get very happy. I said, no, without Uttarbasti, patient should get conceived. That is my thing. Very less interventions.
Dr. Rahul?
Yes. The question is from Dr. Rahul.
Yeah.
Other than Basti and Uttarbasti, which is the most effective Shodhan karma in your experience for menstrual?
Other than Basti and Uttarbasti, which is the most effective Shodhan karma in your experience? Virechan. because it is
Okay.
indicated. Virechan is a bija shuddhi, bija karmukta. In menstrual disorder, it increases the bija karmukta. Ultimately, when you increase the bija karmukta, good folliculogenesis, good estrogen secretion, right? Good estrogen
Right.
supply to the endometrium.
Yes.
You can go for Virechan.
Okay. One question from Dr. Prajakta. In Asherman syndrome, after undergoing hysterolaparoscopy for removal for adhesions, for regeneration for endometrium, will the same line of treatment work?
Yeah, Asherman syndrome, we go for PRP also. PRP and all, stem cell also. So you can go adhesiolysis if patient comes to you after post-operate patient, then you can go for Uttarbasti or Pichu.
Okay. Okay,
But
ma'am.
just see that it should the active infection should not be there. You should always rule out the active infection before doing the Uttarbasti procedure.
After doing all the adhesiolysis also, sometimes we should take care of that. Adhesion should not be again form in that particular.
Yeah.
Because
Adhesions
most of
has
the
that
time,
tendency.
yeah, if they have the tendency when there is a low estrogen level and adhesions are there.
Yes.
So that precaution we should take.
Yeah.
Means,
But in active adhesions also, we give Sharabasti, Shara
Yeah.
Rela Uttarbasti.
Yeah.
Okay. So, ma'am, which is better, PRP or stem cell installation in Asherman syndrome?
There is no better as such. Obviously, stem cell will be the gold. After all. PRP has its own limitations. Multiple sittings are there. Yeah. So
Okay.
stem cell. If there is no better and less better. Stem cell, of course.
So, any other question?
So I think it will promote the growth fast.
Yeah.
Any questions?
And one more thing I need to add, while doing this drug delivery using vaginal canal as a medium, please make sure that it should be infection free. And for that, you go for the anti-infectious measures like Yoni Dhawan with Rifel and all antimicrobial drugs, Panchavalkal etc. and Zatedi oil etc. Nimbatel etc. oils, Pichu. First, make that area infection free and then do your drug delivery. Otherwise, your drug absorption may not be good because of the hampered pH or the infections. So the pre-op procedure is clearing of the infections with the other procedures, Yoni Dhawan and all, and then go for the drug delivery.
Yeah. Next question.
And Shodhan Karma, Uttarbasti is not a Shodhan Karma. The question was which Shodhan Karma is good in my opinion. So Uttarbasti is, in my opinion, is not Shodhan Karma.
Any more questions?
Yeah, which drugs would be best for Yoni Dhawan and Pichu in endometrium?
So please repeat question.
Which drug would be best for Yoni Dhawan and Pichu in thin endometrium? All Vata Pittatma. Yoni Dhawan is not very useful. I told you that initial infection, please make it infection free, that clean that Yoni Dhawan. And then you go for the Pichu. So all the drugs which are Vata, Pitta, Shamak, Bruhan, Balya, and are frequently used in Rasayan Vajikaran, go for it. Okay, Ashwagandha oil, you can go for it. Chandanbala Lakshadi, Mahanarayan oil, Kshirabala oil, Dashmul oil. As per pathology, you can go for it. In my personal experience, Palagrit Pichu and Mahanarayan oil are good. And Chandanbala Lakshadi and Kshirabala Matra Basti is good. Because there are many options, but
Ma'am, can I ask question? Next question is, what Ayurvedic induction protocol you follow in such patients? Protocol.
okay, so I hope I'm clear with all the questions. If anything, please ask me again.
Ma'am, what Ayurvedic induction protocol you follow in such patients?
Ovulation induction.
Ma'am, ovulation induction or for thin endometrium also?
Ayurvedic protocol. I don't believe in protocol personally.
Okay.
Because every patient is different. People are going towards the personalized medicine, and now Ayurvedic people are going to the protocol. A very big tragedy. So there is no protocol. You need to assess the patient. First of all, you need to go for Vata, Pitta, Kapha, and as per that, and associated symptoms are also important. What are the associated symptoms? And as I already told you that it is a Vata Pittatmak condition. Go for Shatavari, go for Avipattikar, go for Mrudu Virechan, go for Matra, like I told you, the oils. Give Dadimadi, color. These oils, Sukumar Grita. These are the options. But there is no such protocol. And one should not follow, in my opinion, any protocol because each and every patient is different.
Yes.
But these are the common drugs which we can go for. Hope I'm clear.
Any questions remaining?
No, ma'am.
Sujata ma'am?
No, ma'am.
So I think we should conclude then.
Yeah, okay. So,
and yes, everyone, just last question, last thing I just remembered that Rakta Prasadan, that is blood purification, is very much important in endometrium. Blood purification, Rakta Prasadan. Can anybody name any one drug for Rakta Prasadan in the chat box? Anyone? Blood purification? Sariva, very good. Go for Sariva use. Sariva, yes. So it also works brilliantly in thin endometrium. So go vascularity will increase. Endometrial evaluation ध्यान में रखिए, biophysical profile ध्यान में रखिए, आपको treatment protocols हो जाएंगे. Patha, very good. You can go for Patha also. Yes.
thank you, ma'am. It's a really wonderful session.
So I hope that's it from my side. Thank you for having me here, Dr. Priyanka ma'am. Thank you for giving me this opportunity. Dr. Sujata ma'am, you're very senior to me. Thank you for introducing me.
It was a wonderful session, ma'am. It's our pleasure to hear you.
Sorry.
It's our pleasure to hear you for your wonderful talk.
Thank you so much. Thank you so much, ma'am. Thank you, Dr. Meenakshi ma'am, Dr. Sujata ma'am.
Thank you, ma'am, for being here. It was a wonderful session, ma'am. Thank you, ma'am. We would love to hear you again, ma'am.
Yeah.
Yes, definitely.
Actually, it is very. I couldn't. I wish to explain that Rasa to Shukra regenerative medicine in a very different approach. But what happened? The things get mixed. Actually, topic is quite. This is different topic, and that is different topic. We can talk later on.
Yeah, later on we will talk definitely, ma'am. We will have another session for that.
Yeah. And adenomyosis also, ma'am, will have another session on that.
There is, see, everybody is interested in Ayurvedic treatment. I always say everyone that modern OBGYN kitna bhi surgically, I'm not saying about obstetrics, but gynecology needs Ayurvedic treatments. Agree or not?
Definitely, ma'am. Yeah, ma'am. Definitely.
Thank you. Thank you all.
So, Dr. Priyanka.
Thank you for the wonderful comments. All of you, keep in touch. Love you all. Thank you so much.
Love you, ma'am. Love your session. It was wonderful.
Meet you soon.
Yeah, Vardha rocks.
Meet you soon in Nagpur.
Yeah.
We also have lots of work is there.
Yeah.
Yeah. And you're doing great. Very inspiring.
The support of you all. It's not a one-man army.
Exactly.
People like you are always there for me. So I am very much lucky for that.
and women like you. True example of women empowerment. You are. I never tell this to any lady. I tell you. Yeah, very rare. Women are like this.
Thank you so much.
Very true, ma'am.
Thank you.
Yeah, thank you
Thank
all
you,
of
ma'am.
you. Thank you. Wonderful comments. Thank you so much. Very happy, very satisfied.
Okay, Sujata ma'am.
Yeah.
Yeah, please conclude the session.
Yeah, okay. So on behalf of NIMA 𝙀𝙃𝙄𝙉 Society and NIMA Center, it is my great pleasure to propose a vote of thanks for this webinar. I would like to express my gratitude to NIMA Center President Dr. Vinayak Temhunikar sir, Secretary Dr. Ashutosh Kulkarni sir, and Treasurer Dr. U.S. Pandey sir for their remarkable support to form NIMA 𝙀𝙃𝙄𝙉 Society. Thank you to all dignitaries of NIMA 𝙀𝙃𝙄𝙉 Society Center, President Dr. Kamini Dhiman Madam, Secretary Dr. Priyanka Nakade Madam, and Treasurer Dr. Vishnu Bhavne sir for giving me this opportunity to coordinate such a wonderful session. I would like to thank and extend my gratitude to our eminent speaker, Dr. Pratiksha Rathore Madam, for giving all the practical knowledge we needed. And I would further like to thank our NIMA 𝙀𝙃𝙄𝙉 Maharashtra President, Dr. Suhas Herlekar sir, Secretary Dr. Manoj Gaikwad sir, Treasurer Dr. 𝙀𝙉�ボ sir for their support to conduct today's webinar. Also, I thank Dr. Archana Pandey Madam, Dr. Daga sir, and my coordinator, Dr. Meenakshi Madam.
Thank
And
you.
last but not least, I would like to thank from the bottom of my heart to all the participants for their presence. Now, with the due permission of all dignitaries, I am concluding today's webinar. So thank you all of you for attending the session. So looking forward to see you all soon in our next webinar or seminar. Thank you.
Thank you.
ma'am.
Thank you all of you. Thank you, Pratiksha ma'am. Thank you so much.
Thank you so much.
Thank you, Pratiksha ma'am. Thank you, Priyanka ma'am.
Thank you.
Thank you, Sujata ma'am.
Thank you. Akhil, you correct?